The treatment of urinary incontinence depends on the underlying cause and severity of the condition. Here are some common treatment approaches for urinary incontinence. A. Lifestyle modifications. Making certain lifestyle changes can help manage urinary incontinence. These may include learning techniques to gradually increase the time between urination and regain bladder control. 2. Scheduled toileting. Establishing a regular schedule for urination to prevent accidents. 3. Fluid management. Adjusting fluid intake, avoiding excessive fluids before bedtime, and reducing bladder irritants such as caffeine and alcohol. 4. Weight management. Maintaining a healthy weight reduces pressure on the bladder. 5. Smoking cessation. Quitting smoking, as can irritate the bladder and worsen incontinence. B. Pelvic floor exercises. Strengthening the pelvic floor muscles through exercises known as Kegel exercises can help improve bladder control. These exercises involve contracting and relaxing the muscles that support the bladder. Depending on the type of urinary incontinence, certain medications may be prescribed. These can include 1. Anticholinergic medications. Help relax overactive bladder muscles and reduce urgency and frequency of urination. 2. Topical estrogen, for women. Used to improve the tone and function of the urethral and vaginal tissues. D. Medical devices. In some cases, medical devices may be recommended to manage urinary incontinence, such as a device is inserted into the vagina to support the bladder and reduce leakage. 2. Urethral insert or penile clamp. A small device that compresses the urethra to prevent leakage. E. Interventional therapies. For more severe cases or when other treatments have not been effective, certain interventional therapies may be considered, including 1. Botox injections. Injecting Botox into the bladder muscle to relax it and reduce overactivity. 2. Nerve stimulation. Electrical stimulation of the nerves controlling bladder function to improve bladder control. Bulking agents. Inject substances around the urethra to improve closure and reduce leakage. In some cases, surgical procedures may be recommended, especially for stress incontinence or certain structural abnormalities. Surgical options can include 1. Sling procedures. Placement of a supportive sling around the urethra to improve control. Success rates for these procedures are typically high, with reported success rates ranging from 70% to 90% or higher. 2. Bladder neck suspension. Surgical support of the bladder neck and urethra to reduce leakage. Success rates for these procedures are generally favorable, with reported success rates of around 70% to 90%. 3. Artificial urinary sphincter. Implantation of a device that helps control urinary flow. Success rates for this procedure are generally high, with reported success rates of around 80% to 90%. The specific treatment approach will depend on the individual's condition, medical history, and the recommendations of healthcare professionals. It's important to consult with a healthcare provider for an accurate diagnosis and personalized treatment plan for urinary incontinence.